Paddy, you've been auditing a long time, probably the most experienced NDIS auditor in Australia. We're very lucky to have you as part of our team. What are some of the common non-conformances that you typically see in NDIS audits?
Typically, I guess one of the big things is just generic policies and procedures that then don't reflect what an organisation does. So the policy might refer to a compliance register or an incident register, and then that's not implemented. So gaps with implementation because the system simply doesn't suit the organisation. Another really surprising one actually is worker screening. Back in 2021, the worker screening transition period ended in most states, and organisations just don't keep up to date with that sort of information. So actually knowing what worker screening is needed, who needs to be screened, like company directors, key personnel, and they forget about those people when they're working on that, as well as working with children checks, which is really important because the legislation in every state is different. So providers can get caught out if they're working across multiple states. A couple of other big things, so incident complaints and analysing data to demonstrate improvement. So that's a particular requirement of the standard. It's very easy to do, to analyse that data, but often the records are lacking. And we see the same sort of thing in emergency and disaster planning, where the standard requires testing of plans and people don't keep records of testing of those plans. And again, that can be very easy. You can record that sort of thing in an improvement log. If you've had a power outage, that's in an emergency or disaster scenario. So record what happened. Did it have an impact on your organisation? Did everything continue to work well? So it's a lot more than just that fire and evacuation drill that we see. Worker training and lack of records, again, particularly for senior management and key personnel. There are lots of requirements in the standard for training, so it's really important that providers keep records of that type of training. And it doesn't mean formal training. It can be informal training, training on the job, training in the organisation's systems, but keeping a record of those types of things. Particularly individual participant training. So if there are participants with behaviour supports and restrictive practices, people need to be trained in that person's individual plan. So again, it's important when you're working with that practitioner that you keep a record of the training received. And finally, probably the most important gap that we see, or it's not that it's a good gap, is differences in participant files. So you'll go through a file and it'll have a range of information that conflicts. So medication information that's inconsistent, or it'll say that a person has a particular health need, but then there's nothing in the plan about that health need, or there are risks that staff talk about with that participant that aren't identified within participant records, or support plans then don't match the risk assessment. And again, that's really, really important because that's a huge risk to the organisation when you get that wrong. So they're the key things. And I guess to sum it up, just make sure that you keep good records of everything. So once you have good records, then you can demonstrate that evidence.
Thanks, Paddy.